Hello, viewers. You're welcome to DS Online TV, and this is your Let's Talk Health segment. And we are in the month of October, and one of the artists said, "Yeah, penu fono." That means everybody like breast. Breast is life. Anyway, whether you agree with me or not, everybody, once you're born, you're going to suckle on your mother's breast. And the month of October has been designated for the disease of breast cancer. And we're going to speak about that today. To help us do this today is one smart lady who has 14 years down her sleeves as a public health nurse. And she is with the Volta Regional Hospital right here in 𝐁𝐫. Ladies and gentlemen, help me welcome Millicent 𝐁𝐫𝐞𝐚𝐬𝐭. Hello, Ma. You're welcome.
Thank you, sir.
How are you doing?
I'm fine, and you?
I'm doing great. Today, I'm trying to talk softly because it's the first time I'm having a female on my segment. So,
Really?
yeah, so I'm so pleased to have you today.
I'm blessed also.
And today, we're going to delve into something that is also a disease that troubles a lot more of the women. And that's why we have here today. It's breast cancer. When you say breast cancer, what is that?
Okay, so I want to take the opportunity to also say hello to your lovely viewers. If we say, before we even talk about breast cancer,
Okay.
I want us to look briefly about what cancer, we say what cancer is.
Cancer.
Yes.
Okay.
So when we say cancer simply is just the abnormal growth of cells. We have cells in our body.
Okay.
So when our cells grow out of order, then we say that you have cancer.
Okay.
So everywhere the cells are and they grow abnormally, then the name is being attached.
So wherever the cell is growing abnormally, then you attach the name.
The name.
So do you have cells in the eye?
Yes, every part of our body.
So you have eye cancer?
Oh, probably.
possible.
Yes.
Okay, great.
So when the cells of the breast are growing out of order,
Okay.
then we say that you have breast cancer.
Wow.
So we also have cancer of the bone.
Okay.
We have a liver cancer.
Okay.
So it means that is where the cells are, the abnormal cells are in the liver. So we have cancer of anywhere. Even the blood, cancer of the blood.
That's the leukemia.
Yes. So basically, when the cells grow out of order, wherever the cells is being attached, or where the cells are, and then they are not growing in that desired order.
Okay.
Or pattern, then we say that's cancer. So basically, that's breast cancer.
That's breast cancer. Cells in
of the breast growing out of order. Yes.
Okay. So last time we had a gentleman who spoke about HPV, and he gave an alarming status. That's what is happening in the country. He said about, hey, let me not tell a lie. I've forgotten my figures. So what's the current status of breast cancer in the country now?
Okay.
Or if you have a global figure too, if you can finish us with that. The current status.
So for now, between 4,000 to about 5,000 of our women.
You don't mean it?
Yes. When we say incidents, they are the new cases that are just being diagnosed.
No, and please come again. Do you mean those are the new cases we are having?
That is being diagnosed, yes. And then the prevalence, that's both old and the new cases all together. So you can see that between 4,000 to about 5,000 of our women. In fact, it's very alarming. And this is the most common type of the cancer among women.
So it's top of the list.
Breast cancer is the most common cancer. And this is the cancer that is killing most of our women. So, in fact, it is not a good thing for us.
No, I'm not getting the picture too well. 4,000 to 5,000
of our women
in Ghana.
Yes.
Having breast cancer.
Yes.
I was reading somewhere on one of my social media, it's a WhatsApp platform. A friend in the United States said he lost a colleague due to breast cancer, I think just last month. And this is serious.
It's a global issue. It's a global issue, but down here to us, it's even a bigger issue.
So do you have any picture of what is happening in 𝐁𝐶?
Oh, yes. There are still some cases that we see. Maybe we'll not be able to maybe put the
figures together.
Yes. But then sometimes the issue is about 70 to 80% of these women that are being diagnosed, they come to us in the very late stages.
About
70 to 80 of these
so
women
in that
have
case,
been
when you're
diagnosed,
having about 10, about 7 people are coming late.
they are coming in late, around stage 3, stage 4, where possibly nothing can be done about it.
Hey.
So it's really an alarming situation.
Wow.
Yes.
Wow. So can we have the possible causes? What causes cancer? Let's go there, because you mentioned stages. So I want to quickly get the causes first, then we go into it proper. Then we see the various stages and what it characterizes those stages. So what are the causes?
Yes. So when we talk about the cause,
yes,
you first made mention of HPV.
Okay.
Yes. So that one, it has to do with cervical cancer.
Yes.
So the human papilloma virus causes cervical cancer. So that one, the cause is known. But this breast cancer that we are talking about, the cause is not known. So there is nothing that we can lay a finger on that this is the cause of breast cancer. But there are some factors that we can say contribute or makes it more possible for people to have the disease.
We don't know what causes breast cancer.
No. There is nothing we can lay a finger on, but there are some risk factors that can contribute.
No, so what are those risk factors?
Yes. So some of the risk factors, one is age.
Age?
Yes. As you age, the possibility of you getting the disease is there. And this one, there is nothing you can do. So usually around age 40, 50, we see our women, some of our women being diagnosed of the, but now, even in the young ages, we are having our women or our ladies having this disease. Yes. Then one of the other risk factors that we can also talk about is hereditary.
Okay.
Or let's say family history. So once it is in the family, someone in the family has suffered it. The gene, you can't decide the family which you should be born into. So the gene probably will run through. So other people also are possible to be born with those genes and later may surface in life.
So now when you want to select a spouse, we'll go and ask you, we'll go and do background check. If you have anybody
probably
down there,
that is what our mothers and fathers had at the back of their mind, that they were doing that for us.
Oh, okay.
Yes. So that is the other one too. And another one too is those who take in alcohol.
So Rabia.
So when you take in alcohol, also your risks or chances of getting cervical, the breast cancer is also there.
Let me mention the next one. Probably when you smoke as well, right?
It's also there. So when you smoke,
they are twin brothers.
Yes, the possibility of you also having the disease is also there. Then also those who have not given birth before. If you have not given birth before, and then if you are giving birth, your first birth is after 35 years, you also stand a risk of having the disease.
Madam, do you know the economy is hard? Now we can't marry early. You are talking about 35. You hustle, life blow you fine before you. Hey.
Yes. So it's a concern. Some of the risks, there is little or nothing you can do about it. Yes. But we will go forward and we'll see some of the things that we have control over that.
Okay.
Maybe we'll possibly have to do something about it. The ones that we cannot do, we leave it to God. Yes. So one other risk factor also is obesity. Yes. So those who are, who have put on so much weight and all that, they are inactive, they also stand a higher risk of coming into contact with it. Or let's say having this disease. Yes.
Okay, but nowadays the women glorify obesity. Charlie, I want to have weight, and people go and take a lot of things in. Even people take family planning to put on weight. Please, I didn't mention that. So people do a lot of things to put on weight, and we are saying that most of the the episodes we had earlier, obesity
seems to run through.
Yes, through. Drinking and smoking runs through.
Yes.
So these are things that we can prevent ourselves.
Those are lifestyle
issues.
Yes, and they are lifestyles that we can modify.
Please, there's one thing I want to ask. Taking noodles, does it also have any? Does it have any?
It's taking noodles is not really
It's
an
not
issue, but
directly, but you become
taking
obese.
it well, maybe with veggies and not making it so much. A habit always taking.
Let me not spoil somebody's business. Let me leave that one over there. Okay.
Yeah.
Then, a quick question. Is it possible that a man can also have a breast cancer?
Yes, so I'll just comment that female, we as a sex, as we being female, we stand a higher chance of having the breast cancer. This because we have the breast, but men also do have. Men also can also suffer breast cancer.
We get chest.
Yes,
you never breast. You have.
No, you have. Is a muscle. So once the breast tissues and things are there are men that you can see that they are really
protruded nipples.
They have it.
Oh, but my friend will tell you
they are
it's as useless as a man's nipple. It's useless. It's
not useless. Sometimes for pleasure, some of the ladies also. So it's not useless. Yes.
I thought it's useless. Okay.
In as much as you derive pleasure from there. Some
I don't know
women
anything
also
about that, so
derive,
please. I'm making disclaimer.
Oh, really?
I don't know anything about that.
Okay, all right.
Okay.
So men are also at risk. So when we are talking about breast cancer, it is not only about women. Though women stand a higher chance because they have the well-developed breast and all that.
Please.
Men can also.
Okay, so
then,
can chicken also have breast cancer? You have chicken breast.
Not at all.
Okay.
Oh, let me say that studies have not
been made yet.
Yes.
Just by the way.
Then also hormones. Those, let me say, those who are on this hormonal therapy and those things, and then use of some hormones for a prolonged period can also risk you to having the disease, especially the hormone estrogen. Those who have been on that hormone.
Okay.
Some of our drugs and some other stuffs. There are people who go under hormonal therapy and all that.
Okay.
Yes. And some of our drugs that we use also contain estrogen. So if you are on it for a very long time, yes, it may also expose you or risk you having the
But when you're talking about the hormones, you keep mentioning estrogen. What of testosterone?
Testosterone, not identified as a risk anyway, but then that's a male hormone.
Yes.
But the estrogen more in female.
Okay.
Yes.
Okay.
Yes.
Okay, so can we have some signs and symptoms?
Yes. So the signs and symptoms, we will say pain in the breast. When you start having pain in the breast, it is something that you quickly will have to pay attention to.
Pain in the breast.
Yes, and then you get close to your health practitioner for them to have a look at it. Then also, if you feel any lump or unusual maybe mass in the breast, you need to quickly report it to the hospital.
Okay.
Then also, rashes around the breast. If you have unusual rashes, we all know. If you have any unusual...
So that means you do have rashes around your breast?
Sometimes, it's just like any part of your body that maybe sometimes rashes, some abnormal rashes will appear.
We hardly get rashes over there.
Oh,
I don't know about the rash there anyway.
Okay.
It's only pimples that come on my chest, the middle part.
Oh, okay. So when you see anything that is not usual, yes, you need to report it. Then we all know the size of our breast. Generally one of our breasts is slightly bigger than the other. Some too is so obvious. But if that is how from the beginning you started developing breast, it is, then there's not too much concern. But all of a sudden, knowing the size of your breast, then you are seeing that one of your breasts is becoming more bigger than the other. It calls for a concern.
Okay.
Then our nipple. Not all of us have that very well protruded nipple, but we know how our nipples are. Some are well protruded, some are, let's say, medium.
They are well protruded. Now you are talking, you are like me. I don't know how the things look like.
You don't know.
I don't know anything about it. Tell me more.
So maybe very soon when you get there, you will see well. Yeah. So now just be thinking. It means the nipple is coming now. Maybe you can go on like social media and probably look at how the breast, then you can appreciate what I'm talking
I
about.
thought you'd take me to maternity ward so I'll go and see breast.
Oh, that's somebody's own. So
Anyway.
the nipple, sometimes it's well protruded, meaning that it's out. You can well see the nipple. Some
Okay.
to the nipple is not that out. We have some to that are inverted, like it's inward and all that. But if that is how from the beginning it is when you were developing breast, it's normal. But you have a well protruded nipple. Then going forward, or sometime you realize that the nipple has started going in,
Getting
like
inverted.
inward. Yes.
Is it the nipple, the frontal part that is coming in, or
Yes.
is it areola or whatever? What do you call it?
The areola is a black part
yes,
of
the
the
black
breast.
part. Is it that part going
No,
on? You're
not
talking
that.
about
That
the
is areola, but the
nipple itself.
where the milk comes out into the baby's mouth. You need to get there soon and appreciate it better.
Don't worry.
So the nipple is
That pointed part of it.
that pointed part of the breast
Getting inverted in.
going in, inverted. That's the word.
Okay.
So when you see that, and then this was not a usual thing for your breast, then it means you quickly will have to come to the hospital for checkup.
Okay.
Then also you having redness of the breast, the skin of your breast is becoming reddened, and that is not the usual. We all know our color.
Okay.
Yes. So that one too is an issue of concern. And then also there is a abnormal discharge. You see bloody discharge, greenish,
Green.
yellowy. Yes, of course.
Yeah, I just screamed.
Just last this week? Yes, this week we are doing some screening at the market, and we saw a discharge, a bloody discharge.
I thought you said green.
Oh yes, there are
Green discharge from the body.
greenish discharge.
Greenish.
Yes, you see brownish discharge. So all these discharges are abnormal. Probably some will get clear
Wait,
fluid.
you go and be squeezing the breast to see the discharge.
It's part of the how we examine the breast. So maybe I hope time will be allowed.
Yes,
you do that
I want to become a professor in that demonstration. I want to be a professor. So
you need to be certified. Maybe I will have to train you and certify you before
that
you
one,
can
I'll take
do
that
that.
certification.
You
Don't
take
worry,
that
I'll
one.
go for that one.
When it is October, you want to become
A breast expert.
well noted.
Okay.
So then there's one cardinal sign that we call the poudirange. Poudirange is, I think, a French word. You see the way the peel of an orange looks like with the dimples.
To be.
Like that. So when the skin of your breast looks like the back of the orange, you see that's the dots, that's indented or dimple kind of is on the breast, and it's so obvious you can see, so clear. That is one of the cardinal signs of breast cancer.
So those dots, are they where usually like the pores?
That's where the
hair comes from. Those are the places that are going to get infected or something.
Those are the places that you see the dimple
like spots all over. Okay.
Just like the way the back of the orange is, we call it the poudirange.
Poudirange.
Yeah. So once you see that sign, it's a very cardinal sign of breast cancer.
Okay.
So when you see that, quickly you have to rush to our end. It's not, if you are even examining your breast, you will be getting there. You may not even get there to see that. But if you are not doing that and all of a sudden you are seeing that, you have to be on your heels.
That means your stage is gone far advanced.
Far. It's more likely that it could be what we are thinking. Yes.
I think you have mentioned quite a number of signs and symptoms.
Yes.
We are also racing against them. Have we exhausted all the signs and symptoms?
Probably this will be okay. But, if I want to clarify more the pain, the pain, we have what we call the menstrual, or let me say the ovulation pain. Before we women ovulate and have our menses.
As for you people, you always have pain.
We are fearfully and wonderfully made. So everything about us is so special.
Every time people complain.
So...
Look, let me chip in this. I've never seen a healthy lady before. Every day you meet them, either my head, and I'm having migraine, and my breast, my nipple, my waist, my abdomen. Every day people have pain. Anyway, that's just one of those.
That is so special about us. Yes.
Oh.
So the ovulation pain, usually during that time of the month, the breast become, dense, painful and all that.
Okay.
Because we're about to menstruate.
Do I say very sensitive? Can I use that word?
Also sensitive. Yeah, it could be. It could be sensitive. But, at that time, because of the hormonal changes that are occurring within your system, yes, it becomes heavier. Yes. Because, the ovulation is just like you are getting ready. All that then is all towards you making your baby.
Okay.
Ovulation, your egg is out. If sperm comes, pregnancy occurs, and then the breast will need to get ready to feed baby and all that. So all that changes is beginning. So if the egg is disappointed, no sperm comes out, then, we have the menses and all that.
So how do you...
Then the breast goes back to its normal because all the hormone changes goes to...
So you want to juxtapose that with the pain of breast cancer?
So with that one... Every month we used to have that pain. That is not what we are talking about.
Okay.
As the pain, but not the ovulation pain. But pain that after even ovulation, it doesn't go. It's still
pain
there.
Is there.
That one you should come. But if it is ovulation pain, of course, once you are done ovulating, the pain will go back.
Okay.
All right. Yes.
Okay. So let's quickly delve into treatment and management.
Okay.
How can this be? Is it treatable, or how can one manage it so that we don't just know about the signs and symptoms? Let's know what can be done to manage the situation.
Okay. So breast cancer is not a death warrant.
Oh, that's relieving.
If maybe say you have a breast cancer disease or something, it's not a death warrant.
Okay.
But our appeal is early detection saves lives.
Okay.
So if you see anything going on wrong with your breast, come early and then we can quickly handle it.
Okay.
Or maybe save the situation before it goes bad.
Okay.
Yes. So when it is seen early, treatment can be initiated, and then you'll be fine.
What are
we have survivors who are there.
Yeah.
So one of it is we have, let's say 4 or 5. We have what we use a surgery as a method.
You cut off the breast?
No, we are not there. So surgery is also one of the means by which it can be treated. Then we also have what we call the chemotherapy.
Okay.
The chemo will have to do with drugs. Then we talk about the radiation therapy. That is use of rays. Then we also have what we call the targeted therapy. We also have the hormonal therapy. So when we say the surgery, we talked about you feeling a lump in the breast.
Okay.
So when there is a lump in the breast, so you need to take the lump out.
Okay.
Then take it with the tissues and the linings all around it. Then we send it to the lab for it to be looked into to see if it has any signs of a malignancy, that's cancer or not.
Okay.
So if we send it and then there is no issue with it, then you are free to go.
Okay.
But then if we send it and then there is issue, then quickly we have to start with the other treatment
with
and all
chemo,
that, or maybe radiation, whatever treatment that may best suit your situation.
Okay.
Then if maybe the disease has spread in the breast, then maybe probably that is where we take the breast, like you are saying, we cut the breast off.
But then that's it goes to the sweetness.
At that stage, it is of no value. It has,
I get you.
It will not do you any good than to maybe deteriorate your health, and gradually you go with it. The breast will be there. You go with it.
Or so you choose between letting your breast take the lead, or you go with it at once.
So that is it. So when we take the lump, we call it the lumpectomy, the surgery to take the lump away.
Okay.
Then taking the breast is the mastectomy. So we take the breast, probably if it's just one, the one is taken. If it has to do with the 2, maybe they will have to take it away. But when that is done, then they will take care of you. Maybe if they have to add chemo, they can do combination of therapies and all that just to treat you. So there are treatments. So depending on where you are or the stage and all that, they can know what to do. Then the chemo has to do with use of drugs.
Okay.
Yes. And so when the drugs goes in, it goes to kill or destroy the cancer cells.
Okay.
And these cells that they are fast growing, they grow very fast in our bodies. That's why you see that when you cut your nails, within some time, your nails are back, your hair is grown back, and all that. They grow at a very faster rate.
Okay.
So when you're on this therapy, that is why sometimes you see that the person's hair and everything is falling off. Sometimes you begin to have diarrhea, you begin to have vomiting. So those are, like I say, the side effects of the chemo. Okay. So when you're on that, you don't need to be worried. Once you are done with the treatment and all that, your hair will grow back and everything all that. Become normal then again. The abnormal cancer cells and all those things are destroyed. Okay. And when we talk about the radiation, the rays are used to destroy the cancer cells. Yes. Then when we say the hormones, I made mention of a hormone being a risk factor. So there, the hormones are being they use whatever hormone that is the causative or causing the issue.
Yes.
Yes, of course, the hormonal therapy is targeted or directed towards that particular hormone as to reduce its production or maybe what to do to limit it so that it doesn't cause problems.
Okay.
Then we also have what we call the targeted therapy. So that if they identify what actually it's causing it, there are some therapies that will be straightly directed or focused to that particular causative issue. Okay. And then the treatment is effective. So those are the means by which, or let me say, the treatment modalities that we have when it comes to treating of a breast cancer.
Okay, this is beautiful. Now you are being more technical, mentioning technical terms. So we are even against time. So as much as possible, let's see the prevention. How can we prevent it? And then we'll wrap it up on that one.
Prevention, we say, is the key. Prevention is the key.
Yeah, prevention is better.
Somebody will also tell that prevention is much, much better than you say you want to cure.
My friend will tell you prevention is better than cures.
Yes. So, and that is where we as a country or health staffs are. We want to, let our voice on prevention be heard more.
Okay.
Yes, we don't even want to get there. Yes, so that is it. So when we talk about prevention, so one of the means by which we can prevent, like I said earlier, is through early detection.
Early detection.
Yes, and how can we detect early? It is only through examination or screening.
Okay.
As I'm here, I will not know if there is anything going on in my breast, not until I examine my breast.
Okay.
So we do encourage the public or our clients or whoever comes to us as we do what we call the breast self-examination.
Breast self-examination.
So that's
other party doing for you.
So that is where you will have to what?
Do yours.
Examine your breast yourself. If you are a fan of doing it, you are even more likely to even identify any problem faster and come and report than waiting till maybe probably it's a breast month like this October
before somebody comes to do it for you.
Somebody will come and check and say there is something or this and that is there. And by the time you have reported, we have effected treatment or whatever it has to be done, and then you are fine.
You keep the two breasts.
The two breasts will be there. You'll be fine. You can be able to move on with life with no problems.
But you can you demonstrate the self-examination?
Yes, I will do
but
it.
I'll do that one for the last, so people will keep watching to the last part of the presentation.
Then what we also, another means is also the clinical breast examination. So the one that you come to us, then a doctor, a midwife, a nurse, or whoever, a health practitioner does it for you.
Okay.
It's what we call the clinical breast examination. So that one you come and then we do the examination and then look at it and see, maybe there's a problem, there's a lump, there is this, that. Then we quickly take care of that. Okay. So those are the prevention that...
Only two?
No, it's not only two.
Yes,
then what we also do, if there is any other, we will also, maybe depending if you see any lump, we may ask you to go and do a breast USG, like take a scan of the breast.
Okay.
It's also look at it. Then women age 40 and above, I encourage to do what we call the mammogram.
Okay.
It's a scan that you have to go and take. We don't have it here, but we have it, I think, in Ho, and then the other...
How often should you go for a mammogram?
Age 40 and above, you need to do it at least maybe one. If you do it once and there's no issue, maybe you can wallow some time and have it done again.
What is the time frame if you give an estimate? Maybe after
if you do it, maybe 2 years, 1 year, every year you can do it.
Do mammogram.
Yeah, mammogram.
Okay.
Then we can have that also done. Then also what we are saying that alcohol, smoking, if you can stop all those things, it's a means of prevention. Then also we should eat healthy, eat a lot of fruit and vegetable so that you have a normal body weight and then you will not get to obesity.
Getting obesity.
Yes.
So the smoking, we should stop the smoking.
Yes,
the
if you cannot stop and wherever you are, you cannot just stop like that. Then you have to, bring it down. Maybe if you take 5 sticks, maybe you have to bring it to maybe 3 or 2. Then gradually till you're able to do away with it.
Charlie, they say the herb and the drink, it be God will give. So they treat everything.
It's a gradual thing, but it's affecting you. They use it for medicine. They use it to prepare drugs and other, but the quantities that they use are different from how we are using it. Yes.
Okay.
So I won't say it's not good. Those heroin and those things, they're all being used to prepare medicines and all that.
But they use
in an appreciable or a desired quantity. And its effect and all these things are monitored. Okay. But not the way our youth are abusing it.
Okay. You mentioned under preventive measure again, all that's all. Yes.
Then also our women. When they give birth, they don't want to breastfeed their babies. My breast will sag, my breast will do that.
This one I want to say. Tami, no.
Yes. Babies. So our babies should be breastfed. Yes.
Yeah, babies.
So women who don't even breastfeed their babies, they stand at a risk of developing the disease.
So it's not about men suckling on their breast.
Let me make this clear. Men sucking their breast do not add cancer to the breast and do not take away breast cancer. When the man suck on your breast, it doesn't take away breast cancer. At the same time, it does not add or it doesn't give you breast cancer.
You just poor market.
What you are getting is just pleasure.
You just poor market.
So if a man is sucking your breast, holding or doing whatever, he's just deriving pleasure.
When we do it, it's also part of the breast examination. But we have acknowledged
that, yes, you are partners in screening our breasts.
That's already enough.
So if the man is holding it, our husbands are holding our breasts. They are likely to also detect something. So, sweetheart, it looks like this time I feel something harder here. Or now the breast is looking this way because he has been having that frequent contact. So he may be even able to prompt you.
So they should give it to us frequently.
Yes, they should. The legalized one. The legalized one. The legalized one.
Okay.
When they are doing the massaging and the sucking and all that, and there is anything, and they should also pick it up, prompt their women, and they should encourage them to come. The thing you are sucking, not that you are taking something good. So know the kind of breast you are sucking or holding. Let the woman go and have it checked. They know that the breast you are holding is certified. So now if I see my colleague men, I tell them that, bring your breast this month. Let me certify the breast you are holding or sucking on.
I tell you.
So that you can know that you are eating a wholesome breast.
This one is bread.
Wholesome breast.
Okay, so one last question before we go to the breast examination. Does the size of the breast have anything to do with breast cancer? Like somebody with busty may be prone to, or somebody with the donchi, the mango, the small ones?
It's a good question. A lot of people ask that question.
Okay.
If the size, it doesn't matter.
So it can be as small as donchi.
Yes.
And still have.
Yes.
Then just remove everything.
So the size doesn't matter. You can still have a small breast and still suffer breast cancer. You can still have a big one,
like popo,
and then still suffer it.
Okay.
So, but if maybe it's due to maybe obesity and the breast tissues and maybe the fats are being matched, then maybe that may be a contributing factor. But maybe you have a normal ideal body weight and then you have, let's say you are busty and all that. That is how your breast is, not as because of you are gaining weight. That is why your breast is. Of course, it's not this thing.
Okay, so quickly, if you can just demonstrate how that examination is done.
Okay, can that be probably, can I still do it sitting?
Or do you need to stand before you do it?
Oh, okay.
We can move the microphone
okay,
for
we can
you.
still do it because sometimes we still encourage our women to do it while sitting or standing.
Okay.
But what we say is you do it in front of
a mirror.
A mirror, because the mirror is going to communicate to you when you are doing the breast self-examination. The mirror will be communicating or will be telling you what you are doing or what you are seeing.
Okay.
Unless when you come to the clinic, the clinicians or we are those who see what we are doing and will say this and that.
Okay.
So first of all, you empty your breast, then you stand in front of the mirror.
You empty it.
I say you empty. You sorry. You take off your dress, your bra, your dress, and then you stand
drops.
naked in front of the mirror. Your breast.
Your breast is naked.
Yes, the breast should be naked in front of the mirror.
Yes.
It's like you are getting...
Oh, I'm in. I'm all in. I'm just imagining things.
So you look at the appearance of your breast, the size, the color. As you have taken off, naked your breast, you are looking at the size, appearance, and color of the breast.
There should be good light in your room.
any light that is enough for you to see.
Okay.
So you're able to see that. And then you know if that is the usual of you.
Okay.
After that, so you advise that you bend down, you come forward.
You lean forward.
You lean forward
for
a
the
little
breast to drop.
To the drop, so that if there is any mass or lump, because it is a bit weightier, you can see maybe any movement in the breast.
Okay.
So you put your hand on your waist like this. Then you lean forward.
Okay.
This, you get it?
I'm getting you.
Then if you don't see any movement or you don't observe anything, then you can
now sit back again and stand.
Then after that, you put the breast that you'll be palpating. This is my left breast. So if
when you say palpating, that means that's the breast you're going to examine.
You use the palms of your fingers to go around. And if you say palpate, that is it. So if I'm going to palpate the left breast, I put the left hand at the back of my head.
Your occiput.
This way, occiput. Yes. So I put it here. Then I use the palms of my fingers. So I start from my armpit. There's something we call lymph node. You remember when we go and dash our feet against a stone? Then we say
Zoriku or Zoriku. Then you feel pain here.
Lymph nodes. We call it lymph nodes.
Okay.
All right. So when you have problems in your system, these lymph nodes are at our various parts of the body. They fight against infections.
Okay.
All right. So you see that when you have that
the sore on your leg,
you feel the pain here.
Yes.
So if anything going on wrong with the breast, the lymph node here becomes inflamed.
Okay.
They begin to fight the disease or the infection.
Okay.
And when they are overcome or in the process they are swollen, so we say that they are inflamed. Then they become visible. As we are speaking, they are there. But because you and I are not having any infection, any problem, we are not able to feel them.
Okay.
But once there is a problem, they become visible.
Okay.
So when you touch your armpit, you can feel that them. Those things are there.
Okay.
So you palpate from the armpit or the axilla.
So is your hand going around or what?
Yeah, so it goes round.
Okay.
You press it against the bones there to feel if there is anything there.
Against the bones?
Yes.
Okay.
Then gradually, you bring it to your chest. So you press the breast against your chest and you are moving in a circular motion.
Okay.
And so it's not like you are raising your hand like this. No.
But a thumb.
So you go around. And then you are just moving the hand in a circular motion.
Okay.
So you do it and go around the whole breast in as much as you can. Some can go 2 times, 3 times, depending on the size of the breast. I'm feeling
something around my nipple.
Hey, I have to examine you after this, true. Yes, probably.
Okay.
Then you go around to you're able to cover the whole breast.
Okay.
Then after that, you come to the nipple, the areola you are talking about. So you palpate that one too. Then the areola is a reservoir.
Okay.
So that is why the breast milk or if any fluid or whatever is there. So we press on the black part, which is the areola, to see if there will be any discharge. So you press it gently.
Gently.
Yeah. So when you press and there's any discharge, you will see it. Then usually we use cotton, white cotton, to clean it so that we can be able to appreciate the color of the fluid.
Okay.
And you take note of it. then you change over.
Are you supposed to have some discharge even if you're not breastfeeding or something, you're not lactating mother, even have some discharge?
So usually you shouldn't have any fluid in your breast. I am mother of 3. I'm done breastfeed. I'm not breastfeeding.
Okay.
And so if I palpate my breast and I press on my areola, I don't get any discharge.
Okay.
In the ideal situation, that is how it should be. But in some women, that is where the breast milk passes. It doesn't close or after breastfeeding. So some those who have breastfed their babies, you are likely to see or get some discharge coming. But sometimes it is very clear fluid that you are seeing. Those are not really an issue.
Okay.
And then if the quantity that comes is just something small. But if it is purulent, if I say purulent like it's plenty, when you just spread the thing comes so plenty. That one, then it calls for an alarm. Okay. But those clear fluids and all these things are not issue.
Okay.
Then you can change over and do for the other one.
Oh, so just like that,
thing.
the same way.
That is
from the armpit down to
the
breast, down. Then you come to the nipple.
Then you press on it gently to see if there will be any discharge.
From today, I'm an expert.
So no, I need to certify you. You cannot be an expert just like that. Thank you for wanting to be part of the team, but you have to understand it. Probably, I think maybe 5 years will do before you can hold the first breast for the first time. So you do this and you take note of whatever abnormalities that you will identify.
Okay.
Then quickly draw close to your nurse or whatever and let them know. You do this usually after your menses, about 2-3 days. I told you during menses, the breast become engorged. It becomes a little tense, heavier, and painful, and granular. Like you see that the tissues are So if you are feeling, you may not really get the the result may not be really clear.
Okay.
So usually you want the breast to come back to normal.
So 3 days after
your menses, 2-3 days after your menses, you are to do this.
Is the ideal time to do it?
Is the ideal time. Then every month we are supposed to do it. I want to say that it's a conscious effort.
Okay.
Yes. We know, but sometimes the discipline and that alertness to be doing it is not there. So every woman will need to be alert, to be conscious of it. Then you keep doing it all the time. Okay. And when you are doing all the time, it helps you. If you see anything, you are first to know. Because nobody holds your breast more than you do yourself. Yeah, so every woman is encouraged.
So you will be there holding your breast. Anyway.
But then one thing is those who are not menstruating, somebody will ask them, what of those who are not menstruating?
Okay.
Yes, so they don't have any time they are menstruating in the month. So they can just choose any date in the month, any date suitable to them
those
in the month
once.
Those in the menopausal stages, then they can do it. Maybe if it's every 5th, every 10th, anytime suitable for them in the month once. They also do it to see if they will identify any problems.
Thank you so much for coming. Our time is fast spent, and I want to give you just some, maybe in 1 minute or less, just talk to the viewer. Tell them, if you have anything to tell them, even word of encouragement, any caution, just say a word to them before we wrap it up.
Okay, so I want to tell our viewers that breast cancer, like I said earlier on, it is not a death warrant. Breast cancer is treatable, it is curable if only it is identified early. So I encourage all our viewers, this is the pink October or the pink month. As you can see my ribbon here. So every woman and our men are all encouraged, especially the women, to have their breast checked. We are having the exercise. It's free. Just walk to any health facility that you want to have your breast checked this particular month. It will be done. And then you can ask them that they should teach you how to do it yourself at home so that you can be doing it. And even when you come, it's one of the things we are empowering our women to do. So we teach you, and then when you go home, you keep doing it. And then when you see anything, you come. Then the lifestyles that we can modify, let's modify them. Let's live healthy lifestyles. Let's take away the alcohol, the smoking, then know what to eat healthy so that we can have a healthy weight. And then some of these things, we will not fall victims to them. So I want to encourage, especially our women, at least this month, if you've not have your breast checked before, go and have it checked.
Thank you so much. If you have not checked your breast before, just have it checked. Viewers, thank you so much for being with us, and we are grateful for the time spent with us. That was Madam Millicent 𝐁𝐫𝐞𝐚𝐬, a public health nurse from the Volta Regional Hospital in 𝐁𝐫𝐞𝐬 here. And this is your Let's Talk Health, and I've been your host, Pius. See ya.